Good afternoon. The Office of Councilmember Paul Koretz asked me to make the introductory presentation. My name is Commissioner Irma Beserra Nunez, and I'm also an instructor with the Los Angeles Unified School District Division of Adult and Career Education Program for Older Adults. We're very honored that a representative from the Office of Councilmember Paul Koretz and from the office of the Laura Trejo, the general manager, the LA City Department of Aging, has taken it upon themselves to research the impact of the loss of older adult education to senior citizens, thousands of senior citizens throughout the city of Los Angeles. And so we became aware of the fact that this report was requested on Friday, May 1st, and that the report just came out yesterday, and each of you should have a copy of that report. The report breaks down not only how cuts are impacting the LA City Department of Aging, but also it begins to outline the impact of the programs, courses, instructors, and students that are impacted through all of the elimination of the program for older adults, which has existed in LA Unified School District for over 80 years. Active senior citizens who benefit from this program are baby boomers, the sandwich generation, who are serving the community as a volunteer workforce by being the caregivers and mentors raising their grandkids or jointly raising their grandchildren. They're also the caregivers to the elderly and the disabled. And so they need to remain active physically and mentally. We have courses in health education. We also teach technology literacy, financial and communications literacy. So these are very critical courses that are keeping active senior citizens healthy, physically, mentally, independent, so that they continue to serve their families and the community and do not become a burden on their families or the health system in our society. And so we are aware that there's been a misrepresentation of these courses, that they're being treated as frivolous recreation, unnecessary classes that could be easily dismissed. And so we're very happy to see that this report really seriously analyzes, it's a first step in analyzing the seriousness of the cuts and how these courses are really critical to the success and elevation of our especially low-income families and families living in poverty. Traditional Asian, African-American, Latino, European families value their grandparents as a vital resource so that young adults are able to go work 1 or 2 jobs, go to school at night, and to be able to help their families rise to a new level while the grandparents are holding the family together. So we appreciate this opportunity, and I'm now going to introduce John Darnell, a representative for Councilmember Paul Koretz, and James Don, the Assistant General Manager for the LA City Department of Aging. Thank you very much.
Hi, Chairperson Kaiser and board members, thank you for giving us the time to speak. My name is John Darnell. I'm the District Director for Councilmember Paul Koretz. I'm here today to thank the LAUSD board members, and in particular Superintendent Cortines, for working with the City of Los Angeles Department of Aging over the years. Your relationship has helped forge such a valuable service for thousands of seniors across the City of Los Angeles, and we really appreciate that. So I just want to start off with that. Councilmember Koretz, as a member of the City Council's Budget and Finance Committee, knows full well the impact of when funding is taken away by a state or federal decision. In 2013, when the disaster, which is the sequester, started, the City of LA lost $1.6 million for the senior meal program. The state of California has recently cut funding for older adult education. We realize this puts you in a tough position. And when the funding was cut for the federal sequester, the City of Los Angeles, we covered that funding because we didn't want any homebound seniors or congregate meals to not be had. So we covered that funding. And then before the state legislature and the governor, though, decided to change the funding for older adult programs in the state of California, which we knew would affect the LAUSD and others. Councilmember Koretz, along with hundreds of elected officials, including many of yourselves, community leaders and activists and older adults and seniors, wrote letters and informed them of how this would affect cities and school districts across our state. We tried, as many others did. Unfortunately, late last year, it was altered, so that's why we're at this point. The city of Los Angeles is the only city in California with a Department of Aging. This means the city has its own service area separate from the county, who normally administers social services, unlike the cities. We do work with the county, though, and of course LAUSD. On Friday last week, the City Council Budget and Finance Committee voted to instruct the Department of Aging to create a report that shows the impact to the city if the LAUSD's program for older adults were to be eliminated. We asked for this because we were told the programs for older adults might be eliminated, and on the website also the link is now taken down. We weren't told to do this by anybody. We just wanted to know how we would be affected and where we would stand, since we do have that close relationship. We are not here to badger anyone. We're here to actually thank you for your service and your help over the years in this relationship we've had. We're just to inform you, how we would be affected since we've had that close relationship. We're thankful for the relationships we've built with you, and we look forward to continuing that for the older adults and seniors throughout Los Angeles. These programs help seniors in all aspects of their lives, and as Irma mentioned, have done so for over 80 years. The population is skyrocketing at levels we've never seen in the history of our country, and they need our help. So now I'd like to introduce James Don, who's the Assistant General Manager of the Department of Aging. He'll talk more about our report and the programs and services that they administer. Thank you.
Thank you, John. And thank you to the committee for allowing us this opportunity to make some comments, public comments. The Department of Aging, I'd like to start off by thanking the committee, Superintendent Cardenas, for his vision and support, the dedication of the seniors, the teachers to the seniors, as well as Arlene for all of her hard work in making our partnership with LAUSD such a success. The work that LAUSD older adult education instructors and the Department of Aging have been doing, it's actually been nationally recognized by our primary grantor, the Administration on Community Living, as a model for how to bring to scale these life-saving programs. And I'm referring specifically to our evidence-based programs at our wellness centers located throughout the city of LA. These particular programs utilizes evidence-based studies that actually show how seniors who participate will actually show a health improvement. It's always been a challenge for a social service agency to really identify how it benefits the clients. And through using evidence-based programs, we know that as long as we have LAUSD instructors that can follow the fidelity of the study, that all of our clients actually reap those benefits. It's important to know that in a city of over 600,000 seniors, that 70% of those seniors suffer from 2 or more chronic diseases. And half of them don't even have a plan on how they can manage those issues. So it's very important that some of the classes that we offer through evidence-based, such as chronic disease self-management, diabetes management, active start for sedentary seniors, are so critical to the long-term health of seniors. For every dollar that we can save by improving the health of seniors, it means more resources for the city to provide other critical services to its residents, such as fire and police. I just want to point out that the report is not complete. Based on the very limited time that we had to put it together, not all of our contractors have actually had time to respond. So those numbers, in terms of the numbers of seniors who would be impacted, are drastically understated. In the past 2.5 years since we've implemented the evidence-based program, we've served over 10,000 seniors. We average about 4,000 per year. So I fully expect that by the time the department prepares its report back to the city's Budget and Finance Committee, the numbers will be higher and it will reflect services throughout the city in our various areas. And with that, I conclude with my remarks, and I'm open to any questions.
Actually, this is public comment.
Oh.
It's not an agendized item. So if you have questions, if they could be asked offline. That would be better.
And I'd like to say some additional comments. I'm the chair of the California Coalition to Save Older Adult Education, and we're honored that our members include Congresswoman Lucille Roybal Allard, the Senate Pro Tem Kevin De Leon, also our Council President Herb Wesson, Carlos Acala, who's the chair of the Chicano Latino Caucus of the California Democratic Party, Partners in Care Foundation, and many organizations and individuals who understand the urgency of this issue. But we want to especially thank Bennett Kaiser, who represents my active older adult students at the Glassell Park Senior Center and also the Yosemite Recreation Center, and senior citizens and their families throughout Northeast Los Angeles and Southeast Los Angeles. And he has been such an advocate for active older adults. He has passionately understood why these programs are so critical for our families, our communities, and our district. And so we want to applaud Bennett Kaiser for being our champion on the LAUSD Board of Education, and we invite all of you to join him. We know that you all care about seniors. We know you care about all people in the family, and so we hope that you join together to save this program. Thank you very much.